Thank you for coming in again today, Mr. Engel. So, this is our last scheduled appointment. And just like last time, we're going to go over your evaluation scores.
Okay.
So, plaque score is now a 1.3, which means we have gone from poor to fair to we are now in the good range. So, yay! Round of applause for you. I can really see how much you've grown from since the first session that we had. I can really tell like how well you've incorporated that BASS method at home. Your bleeding score is at 36, which is good. It means that we're still on track for getting that score down. It's not as low as I would have liked to have been at this point, but it is still lower. We're still going down, which is the thing that we want to focus on. Are we still snapping the floss down? Are we flossing once a day?
Yeah, I floss once a day, and I don't snap the floss down. I wiggle it down.
Wiggle it down, okay. And are you able to like get back there in your molars?
Yeah.
Okay, all right. We still might want to try and incorporate some other flossing tools, like maybe a threader or even the picks with the floss picks to help you reach back there into those molars.
Okay.
Remember how we talked about those last time? So we might try and incorporate those, maybe even super floss, and it might help with those bleeding scores points. Okay? Awesome. All right. So we have gone over plaque. Can you tell me a little bit about plaque?
Yeah, so plaque is like formed from bacteria. And it can form like 4 to 12 hours, like as early as 4 hours to like 12 hours.
Okay.
Which is why brushing your teeth twice a day is important.
Yes.
And it can form in between your teeth as well as on your teeth, and it's kind of a film that makes your teeth kind of feel funny.
You retain so much, and that's so good. All right, and we've gone over periodontitis. What's the big important thing about periodontitis?
It's irreversible.
Because of?
Bone loss.
Good. All right, and we went over the flossing again. Today, we are going to go over carious lesions and get that appointment set up for you. So our last long-term goal that we have here is have carious lesions restored by 4/30/2026, and understand the cause of caries in relation to the diet, which is going to be today. And patient makes an appointment with the dentist for caries restoration by the end of our appointment today as well. And then patient begins to use daily fluoride rinses by the end of today as well. So we're going to go over caries and fluoride. All right? Okay, awesome. So, in your words, what can you tell me about caries and carious lesions?
I don't know anything.
All right, so it's actually what is commonly known as cavities. What can you tell me about cavities?
It's like a portion of your tooth that's kind of like compromised, where like the enamel, like the bacteria has eaten through the enamel.
Yeah, and actually, no, that's exactly what it is. It's a disease. As you can see here, we have some examples of cavities and like how it can start out small, but if left untreated, it can just grow deeper and deeper and deeper and down into the pulp, and that's like usually when it starts causing pain and sensitivity. All right, and what causes caries and how does it form?
By like not brushing your teeth well.
Yeah.
Or not often enough.
Yeah, no, exactly. So it all comes back down to plaque, right? Not brushing your teeth. Microorganisms, fermented carbohydrates specifically, sugar, and a susceptible tooth surface combined will cause caries when the biofilm is left undisturbed. So basically what that means is that you need 4 things: microorganisms, bacteria, sugar, fermented carbohydrates, a susceptible surface, which is your teeth, and time. So all those 4 together is what's going to cause that cavity. And for you, we talked about drinking lots of Dr. Pepper, drinking lots of sugary caramel frappes, was it?
Mm-hmm.
Not telling you by any means to stop drinking those. I love Dr. Pepper just as much as the next person, right?
Mm-hmm.
But what we want to do is we want to limit those sugary drinks. And instead of sipping them throughout the day, we want to, if we're going to drink one, drink it all in one sitting. And then also, it's good to have them with meal times, especially with the protein, because proteins will they will neutralize those sugars so they're not attacking your teeth. Because once sugars are introduced to the mouth, they will essentially attack your teeth for 20 minutes. And every sip you take after that, it kind of restarts the clock. All right? So, what are possible treatment options for cavities?
Like fillings.
Yeah.
Where they drill out like where the carie is, and then fill it with like a like substance.
Composite is what's usually what's the term is now. Back in the day, used metal fillings. Most offices don't use those anymore. Root canals and crowns too. Another treatment is, like you said, brushing your teeth, because there's such a thing as carious lesions, right? Where it's not a full cavity. It's like the start of a cavity. And if like treated early, no restorations are needed. We can just completely reverse it. All right. And what happens when caries are not treated?
I mean, I guess it could get bad enough that you would lose your tooth, or it could maybe get into your like jaw.
Yeah. So if caries are not treated, patient runs the risk. You run the risk of irreversible damage to your teeth and furthering infection and possibly even losing your tooth. So yeah, no, that is absolutely correct. And how can we prevent cavities?
Besides brushing your teeth?
Yeah.
I don't know.
All right. So, like you said, brushing your teeth, fluoride treatments, which we'll get into fluoride in a moment, limiting and moderating sugar intake, like we've said, chewing xylitol gum after eating or drinking the sugars. Xylitol is a sugar substitute, but it's not quite like aspartame, where it's, a 0-calorie sweetener. Xylitol will actually, kind of like protein, neutralize those sugars. So it's really good to chew after you're eating sweets.
Okay.
And maintaining really dental hygiene appointments. So, once we stop seeing each other on a 2-month basis and we start going back to that 6-month basis, as long as you keep up with those appointments, we should be good.
Okay.
All right. So, like I said, we're going to get into fluoride. All right. And what can you tell me about fluoride?
That they put it in the water.
Most places in Texas do put it in water. You are correct. But can you tell me what it is?
No.
No. Okay. So, it is an ionized form of fluorine. It is a type of mineral primarily found in your bones and teeth. So, it's actually something that's already in your body. It's not something that, we are continuously like introducing to your body that it doesn't know what it is. It's something that naturally occurs there. All right. And what are the purpose and benefits of fluoride? Do you know any of those?
Well, I guess maybe since your teeth are made of it, maybe it would help strengthen them.
So, yes, since fluoride is found in your teeth. It's to help prevent demineralization while also aiding in the reduction of hypersensitivity, gingivitis, and biofilm. So basically, like if you're having sensitivity to cold or heat, like it can help like block that sensitivities. It can help prevent gingivitis, and it can also help limit the amount of bacteria in your biofilm, which causes those caries that we were talking about. And it can also help remineralize your teeth. So remember how we were talking about how we can stop caries before they develop into bigger caries if they're deleterious lesions? Fluoride helps do that. And if demineralization has already occurred, cured. Okay. And what is the difference between remineralization and demineralization?
Remineralization is adding and demineralization is subtracting.
Yep, essentially that's what it is. Process of losing minerals is demineralization, and it occurs when the environment of your mouth becomes acidic, either from repeatedly ingesting acid foods and drinks or from plaque being left undisturbed. And then, of course, fluoride can help remineralize your teeth by attracting and bonding lost minerals to your enamel or remaining enamel and strengthening those bonds. It's kind of like magnets, you know. And, you know, basic chemistry, if you know anything about chemistry and how bonds are formed. All right, and where is fluoride found? Like, where can you receive fluoride? You already mentioned water.
Toothpaste?
Yep. So, like, as you see here, Parodontax is is a popular fluoride toothpaste. Also, we were talking about demineralization and remineralization. So, like, you can see here how it kind of looks after arresting that demineralization. And it can also, so depending on where you live, you can find it in your tap water and ADA approved toothpastes and rinses. So, you know, mouthwash, a lot of people use like Listerine, but there are also other mouth rinses besides that, right? That can help with fluoride, that can help introduce fluoride into your teeth. And you can also have it applied to your teeth at dentist office in the forms of gels, varnishes, and or prescribed therapeutic mouth rinses. But today we're going to start applying the gel. Okay? All right. So what can you tell me about that you learned about caries and fluoride today?
That caries are cavities, what we commonly know. It's where bacteria, plaque has broken down the enamel of your tooth, and if left unchecked, well, it starts as a carious lesion, and then if left unchecked, it can become like, it can go down to the root and cause you to have like a root canal, or even in some extreme cases getting down into like the bone of like your jaw, or like your upper palate kind of area,
depending on where it forms.
Depending on where it forms. And the ways to prevent it or to reverse it would be obviously brushing and flossing, fluoride, like kind of therapy with toothpaste, or like a prescribed fluoride therapy, and that would be like remineralization. Demineralization is where you're losing enamel.
Bless you.
Excuse me. Yeah.
Okay. And the sugars, right?
Yeah. The sugars can cause the demineralization.
Okay.
Because it kind of attacks your teeth, and so it's better to have my Dr. Peppers and my caramel lattes with meals, or chew xylitol gum after to help neutralize it.
Yep, absolutely. Okay, and fluoride.
Fluoride is found in your teeth and in your body, and it's used to remineralize your teeth, and can help with carious lesions to reverse the damage.
Yep. All right. So You've done really good with each of these sessions, listening and really taking in the information and learning everything. And I can really tell when it comes to like your plaque and bleeding scores, right? That you're really taking what we're doing here home with you. And that's the important bit, because remember, we are a team, we're working on this together. So that's so awesome that you were doing so well. All right, so I know I said that this was our last appointment, but I do want to bring you in one more time because of the periodontitis and your plaque score being 1.3 and 36%. Remember, I said I wanted to get that plaque score down to at least 0.5 and that bleeding score down to 0 if possible. So I think coming in another 2 months, so that would be around February. Let's do the 1st of February and get your plaque and bleeding scores one more time. So gonna start a new flossing supplement besides just the regular thread floss, and continue doing the great job that you're doing with your toothbrushing, right? And going to get those restorations scheduled. So by the time that you come back, those will already have been implemented as well. And then also start on fluoride. And then practice what we were talking about with drinking those sugary drinks. Okay?
Okay.
All right. Thank you again for coming in today, Mr. Engel.
Thank you.